Hi there. Most nurses assume Medicare denies documentation because something was missing or because the care wasn't justified. But that's not actually what's happening in most cases. In reality, a lot of denied cases come from documentation that looks completely fine on the surface. So the real question is, how can good nursing care still get denied? And the answer has nothing to do with effort and everything to do with structure. In home health, nurses are often told, be specific, document skilled need, and show homebound status. But what you're not taught is what those things actually look like in a real clinical thinking situation. So documentation ends up sounding like this. Patient seen today, wound care provided, education completed, no acute distress noted. On paper it looks complete, but to the Medicare reviewer, it's incomplete because it doesn't clearly answer the real questions behind every visit. Why is skilled care needed right now? What is actually changing with this patient? What risks exist if this care stops? And why can't this be done by the patient or the caregiver? When those answers are missing, the documentation becomes unclear, even if the care was excellent. Here's the key shift here. Medicare doesn't deny care. Medicare denies unclear clinical reasoning. That means the problem is not what you did. It's how the thinking behind what you did is documented. And this is where most nurses get stuck. They document actions instead of decisions. They document tasks instead of clinical logic. And the gap is what creates the denial risk. This is exactly what I teach in the system called the clinical thinking system. It's a simple way to structure how you think during a visit so your documentation automatically answers Medicare's questions. Instead of writing after the visit and trying to fill in the gaps, you learn to build thinking during the visit itself. So your documentation becomes clear, structured, and defensible the first time. Every home health note is evaluated through 4 core lenses. Number 1, homebound status. Not just patient is homebound, but why leaving the home is medically difficult or unsafe. Number 2 is skilled need. Not wound care provided, but why skilled nursing is required instead of self-care. And number 3, clinical change. It's not a static descriptions, but what is getting better or worse or just staying the same over time. And number 4 is risk if care stops. What could realistically happen if skilled care is not provided? Possible hospitalization, infection, decline, complications. These 4 pieces are clear. Documentation becomes stronger. When they're missing, even good care can look unsupported. So let's compare. A weak documentation is wound care provided, patient tolerated well, no signs of infection. That's incomplete reasoning. Now, strong clinical thinking is patient presents with delayed wound healing and increased drainage compared to prior visit, requiring ongoing skilled assessment and dressing changes to prevent infection and deterioration. Patient demonstrates limited ability to perform wound care independently due to decreased mobility and visual limitations, reinforcing the need for the skilled nursing intervention. No current signs of systemic infection. However, ongoing monitoring is required due to the risk of complications if wound status declines. Same visit, different thinking. And that difference is what determines whether the documentation supports care or weakens it. So if Medicare is looking for structured clinical reasoning, the next question becomes, how do you consistently think that way during real visits without overthinking every sentence? And that's exactly what we're going to do and break this down next. In the next video, I'm going to show you the exact clinical thinking system framework, step by step, so you can apply it during a real home health visit without second guessing what to document. And if you want the full structure in just one complete piece, you can download the clinical thinking system guide in the description below. Thank you, and I hope you have a good day.